Hi, my name is Heussler. Thank you for asking me to talk to you today about our proposal for a Centre of Excellence and multidisciplinary clinic model of care for Prader-Willi syndrome. I'd like to pay my respects to the traditional custodians of the lands on which we all walk, work, talk and live, and also pay my respects to Aboriginal and Torres Strait Islander elders past, present and future. A little bit about me. I'm the Medical Director of Child Development Services in Brisbane, but I also trained as a paediatric sleep physician and certainly had a lot of involvement in the Prader-Willi syndrome clinic that we've had for a long time in my training and after that over many years, particularly in Queensland. I'm also the Medical Director for the Centre for Clinical Trials in Rare Neurodevelopmental Disorders. And while we don't currently have any trials in Prader-Willi syndrome, we're certainly seeking opportunities for this into the future. We do have a number of trials running at the moment with a number of sponsored trials from various pharmaceutical companies supporting autism, 22q11 deletion, Fragile X, Angelman syndrome, Tourette's, amongst others. From this perspective, our whole goal is to be able to bring these clinical trials to individuals and patients with rare neurodevelopmental disorders in Australia. But they do form conflicts of interest for us moving forward. As a background, the Queensland story is much like any other integrated service. However, one of our challenges is that Brisbane's in the very far southeast corner of the state, and most of the population, in fact, do live in the southeast corner. However, there are many families affected by rare disorders that live across the state. And so we have multiple models of clinics across the hospital and health service in various rare disorders such as achondroplasia, 22q11 deletion, Angelman's, tuberous sclerosis, etc., where we have integrated clinics. So families can come to the hospital for a day or two, see everyone they need to, and then go home. However, this certainly does support, to a certain extent, local clinicians to provide care where they live. The integration of telehealth into this space has certainly been a bonus for families in recent times. We have, as part of this, a Prader-Willi syndrome integrated clinic which has been running in some format or another since 2008. And when the two children's hospitals came together at the end of 2014, that clinic has continued. We have a number of medical subspecialties involved in that clinic, so families can see all or just one of the subspecialties as needed on the day. This includes endocrinology, sleep medicine, general paediatrics and developmental paediatrics, as well as particularly nursing from within the endocrinology team and the sleep medicine team as required. However, clinicians have really identified a number of gaps in what we can provide and have looked to a nurse navigation model for more holistic care, particularly in the general health and wellbeing aspects for children and families. We know that families feel lost when a diagnosis is first made, and seeking help can sometimes be a battle. There are lots of things to take in. There may be poor coordination with multiple subspecialists, and it takes time to find us sometimes. Local health professionals are often at sea, and as time goes on, the trajectory is different, with different pressures for all. Transition from paediatric to adult care can also be extremely challenging. There are various rare care models around internationally, and to date these vary quite a lot. Many depend on finding the right person to talk to at the right time. But there are a couple of initiatives in Australia, including the rare care model in WA, where families can be referred to a team that will try and get the family into the right place and provide a personalised healthcare model for them, healthcare plan. There's also a genetic education program which utilises a community of practice model for health professionals run by Dr. Emma Palmer from Sydney, which is really trying to help educate professionals about various rare disorders and a model of care moving forward. But it's often the simplest things that help. That personalised healthcare plan, that coordinated care, the integrated care and communication both vertically and horizontally, that inclusion of aspects of disability and educational planning, access to expertise, access to international trials and best practice. So you don't need to travel overseas to access those sorts of things. That feeling of belonging and the role of that family supports. People with Prader-Willi syndrome really need clinicians who know about Prader-Willi syndrome and its associated comorbidities. Those that can identify when illness is typical of Prader-Willi syndrome, but also when it's atypical, and understands the variability between individuals with the syndrome. Clinicians who know their patients and can support their individual needs and behaviours, but can also communicate that to people locally and on the ground. They also need improved access to medical care, particularly for regional patients and rural patients, and support with problem solving for providers and patients in times of need. And this can also include disability providers and education providers. The simplification integration across numerous subspecialists and therapists in terms of horizontal integration, and proactive management or preventative management of chronic or life-threatening symptoms. And these can all be reinforced by synergistic links between clinical care and research. Coordination is actually quite key in this. Jessica Jewis from Colorado has written about this in establishment of these clinics. It certainly motivates collaboration to provide evidence-based standards of care, increasing knowledge base through research, and offers additional resources for the community. There's a role for these clinics in telemedicine to rural areas, and there's also opportunities for clinical work to actually inform the research. Research goes both ways, both informing what we need to do, but also the clinic informs what research needs to occur. As a care team, we're really charged with understanding the molecular basis of Prader-Willi syndrome beyond the genetics, and develop appropriate clinical outcome measures to bring these therapies to change the natural history of the disorder and improve outcomes for patients in their daily struggles, improve access and decrease caregiver burden. And this has really been emphasised in the development of these centres of excellence. There's really lots of gaps at the moment in care practices, and trying to move this forward is part of the development of centres of excellence and coordinated clinics. We know from the outcome measures from the Children's Institute of Pittsburgh Coordinated Care Service that with coordination of care, there was decreased hospitalisations, decreased emergency room visits, decreased failure to attend at medical appointments, decreased missed school days, decreased caregiver missed work days, and decreased caregiver stress levels. So we can see that simply just coordination can actually improve the lives of individuals and caregivers with Prader-Willi syndrome. In Australia, it's particularly relevant given the long distances that we have that mean that many families need to travel quite some distance to access the expertise required. And this is often in places such as Queensland, often requires plane travel, which for some children with Prader-Willi syndrome can be particularly stressful. And so the more we can utilise things such as telehealth, the better, and this can be a really important factor of what we need to provide from these clinics. Certainly COVID has had one positive in improving our understanding and ability to use telehealth for these sorts of services. When we think about a centre of excellence, we think about tiers of care. So the centre of excellence, which people have access to, but also supporting local care, both local paediatricians and the universal primary care, and others including education and disability support services. That centre of excellence provides access both for health professionals and families to expertise, but it has a significant clinical role in early connections and interventions, understanding international partnerships and keeping abreast of the research, education and standard setting roles in terms of dissemination of that information for both professionals and families, and research facilitation, particularly in the context of natural history studies. We need to know when things aren't following a typical pattern for a child with Prader-Willi syndrome. Data is all important in this. We need to understand symptom management for families and what will actually achieve better outcomes, and certainly understand as genetic trials come to the future what impacts these will have and how it will impact the lives of families. It certainly aligns with international, national rare disease priorities, the UN Resolution on Rare Disease and the National Action Plan for Rare Diseases has 3 pillars: awareness and education, care and support, and research and data. And certainly our clinic model and the coordination aspects will certainly feed into that quite nicely. It certainly aligns with the Prader-Willi Research Foundation's pillars of care, treat, transfer, genetic therapies and connection, and will support those aspects of the pillars quite nicely, I think. So when we think about a clinical role, which is probably the first thing to build on, it really comes down to that multidisciplinary clinic with both virtual and face-to-face components to build the experience of clinicians with network supports, to develop standards of care across the ages, support digital integration, which will then inform research, to develop patient and family partnerships in the care planning, coordinate care with integrated care plans, and support families with health and system literacy, support families' well-being, and provide early linkages with strong identification and prevention focus. And streamlined access. Do we develop a hotline, phone a friend type system and utilise that for services across Queensland, across New South Wales and further afield? So the first steps are probably to build the team, really, thinking about a steering committee, clinical advisory, health economics and evaluation, as well as that digital aspect. We're thinking really very much to start with a pilot, understanding and developing standards of care in the Australian context, and to start with coordination and a nurse navigation model to lead the establishment, particularly in the first instance, of a newborn program, to lead that access planning and to lead that point of contact aspect. So that's where we're really planning to start at the moment. There are challenges. We need to establish a team and establish a team that's inclusive of all, including patients, parents, adults and children, clinical clinicians, researchers and data, people that can support us with data. We need to develop the standards of care document and work with people to do that. We need a data profile that can be adaptable and meet the needs of multiple specialties and systems. We need an evaluation process, which we're currently working on, and we need to think about transition and the whole of life care as well. From a research perspective, we need longitudinal data that is comprehensive and national. We need a platform for local collation and re-identifiable data with upload to potentially a national data set of de-identified data. There are various open source platforms that can readily be adapted to this. We need to establish clinical trials and think about what sort of clinical trials and outcome measures that are actually meaningful for children, adults and families. That clinical trials may be either N=1 trials, adaptive clinical trials, which means just building on various therapies that we already have, or randomized control trials. We need to think about symptom management versus genetic therapies, and we certainly need to think about health system economics. The quickest way to get things embedded in the health system is actually to demonstrate there is a cost saving, and I suspect we will be able to do this with better care and coordination in this field. We need to be very mindful of growth and lifespan and think about the profile across the ages and the interactions with various systems, the family involved, the siblings, and how do we prepare and preempt situations and challenges for individuals with Prader-Willi across their lifespan. We need to think about interfaces with health systems, disability systems, community and social care systems, as well as education, and think about how each of these can be improved and supported for these individuals. Collaborative planning is really important. We need to involve families in our planning of what we're doing and include children and young adults with Prader-Willi in the conversation. There has already been a significant amount of work looking at outcomes that are important to families, and the focus questions really on examples such as hyperphagia and behaviour as being priorities for symptom management are really key in terms of targeting our impact and thinking about what things we can bring to the clinic that can support particularly these behaviours that are very challenging. We need to create a learning adaptive health system and pilot this in a Centre of Excellence model with a continuous cycle of improvement. And this really means that each point in time we continuously reassess where we're getting to. And you need good data for this, and then modify the model as we move so that we have a learning health system to be able to modify and meet the needs of families and individuals with Prader-Willi syndrome. We need to create that centre for clinicians to access support, knowledge, and really understand how they can best support people locally and close to home, and bring those multiple subspecialists together with a common goal in terms of supporting Prader-Willi syndrome, and that's where we talk about horizontal integration. Where are we at? There's been a significant amount of planning done in terms of information gathering, where to start, some consultation with overseas models, and some evidence review. We've looking very much at phase 1 at the moment, where we're currently looking at the Memorandum of Understanding in appointing a nurse to lead the newborn and navigation programs, with agreements currently being established. We're seeking others to help with standards of care, documentation and writing, and building virtual capacity for the Prader-Willi clinics in terms of access support. The next phase will really be about building that data management and building a model to suit all clinics in Australia, no matter whether they're on different forms of electronic medical records or paper records, and building those education programs, working closely with those education programs that are currently in play. We don't want to need to reinvent the wheel, but there are specifics around Prader-Willi that we can support in this space. And then we need to evaluate and continuously evaluate the system and develop that learning health system so that we can move as we need to with development developments that will inevitably come. That incremental phasing of work is particularly important unless anybody can come up with a lot of money very quickly, which is highly unlikely. So we start with what we can at present. And we're going to start with neonatal connections, right start, right place, right time, and work on a preventative basis. How can we intervene early to try and get the best outcomes for the children and families? And we'll plan from there. The evaluation piece is really underway, thinking about health services and economics, family feedback, health outcomes, education outcomes, and family and clinician empowerment. So it's a work in progress. There are lots of challenges, but we're up for it. There are health system challenges, but we're up for it. And we can, and you can help shape the future for your children and individuals with Prader-Willi syndrome. I'm happy to take any questions. Thank you for hearing me out.